During the early days of the pandemic, we heard the stories of nurses and doctors doubling up on their masks, reusing PPE or personal protective equipment, and changing their clothes outside to protect their families or not interacting with their families at all. While at work, they were faced with challenges that were new, terrifying, and in many cases filled with death. Governor Mills would often address what frontline workers were faced with during press briefings.
These are the people sacrificing every day to keep you and me safe as they battle COVID-19 and its enormous effect on our healthcare system and on all the people of Maine.
5 years later now, we revisit with an ICU nurse at MaineHealth Maine Medical Center in Portland who, at the height of the pandemic, was just 5 years into her career. And we're learning how our healthcare industry is navigating new challenges in part because of the pandemic.
Hey, you guys need a hand?
This is the last time most of us saw Brittany Menier. She and her colleagues in the ICU at MaineHealth Maine Medical Center in Portland, protective gear treating the most severe cases of COVID.
We all just try and take care of each other. You okay?
In this video provided by MaineHealth, we got our first raw look at what was happening in our hospitals.
This year, I've definitely put a lot more people in body bags than I would like to in my whole lifetime. I still stand by that comment. I don't know if I'll repeat it without crying, but it still stands true.
This is Brittany today. Her emotion around the pandemic is evident.
That much death and dying and suffering from patients and from family members at 26 years old was a lot.
In the years since the height of COVID, Brittany and MaineHealth say they have seen a few key things that raise concerns. Healthcare providers left the field. We've reported on the nursing shortage and the efforts to attract new nurses to Maine, specifically our rural communities. But the pandemic, Menier says, made it worse.
And then as time went on and the vaccine came out and we were still struggling with people not getting vaccinated and people not understanding that it was a real thing, there was a lot of frustration. And then it was like, well, what's the point?
But there's also a change in the patients, more of them, and they're sicker. This is the data collected by MaineHealth from 1995 to 2025. We're looking at a few things, but the trends are all the same. The first two charts show the number of arrivals to the emergency department and the number of people being admitted through the emergency department because of their condition. Both are trending up since the sudden dip you can see at the start of the pandemic. Then, data going back to 2018. This shows patients at MaineHealth Maine Medical Center in Portland staying there for 20 days or more. Since October of 2020, this number has climbed steadily. An additional 100 patients every month now than in 2018. So to recap so far, more patients who need more care with fewer staff. And there's another layer. Finances.
One thing that's really important to recognize is that our healthcare delivery system in Maine right now is incredibly fragile.
That's Andy Muller, the president and CEO of MaineHealth. He's a physician with years of direct patient care, and he came to MaineHealth during the pandemic.
You know, we're keeping our nose above water barely. Most of the other health systems in the state aren't right now.
He says about 70% of patients rely on money through MaineCare, Medicare, or have their care subsidized. So any uncertainty around those, as is happening in the State House and Washington, creates concerns for patients, for workforce growth, and for healthcare access.
It pains me when I know that we have patients who can't get in as timely as they want to get in. It worries me when patients are stressing about their bills when they should be focusing on their condition. I worry about what happens if other health systems in the state can't sustain themselves and we have gaps in care and healthcare deserts, and how we're going to fill that void.
There's no quick solution. A major focus is attracting a new generation of healthcare workers to meet the care needs and the volume demand as Maine's population ages. People to work alongside Brittany Menier through the thick and thin.
We're very, very thankful for our coworkers. We're very thankful for our family. We're very thankful for patients and families who are kind and who treat us with respect. Yeah.
One more very important point from Dr. Mueller. He said violence against healthcare workers is a problem. The U.S. Bureau of Labor Statistics reports the healthcare and social assistance fields saw the highest number of workplace violence than any other fields in 2021 and 2022. Press Ganey, a healthcare performance solutions company, reported that in just the second quarter of 2022, 2 nursing personnel were assaulted every hour in our country.